Epileptic history taking, a comprehensive guide for patients and healthcare professionals. When it comes to managing epilepsy, effective communication between patients and healthcare professionals is essential. To ensure a thorough understanding of each episode and facilitate better evaluation and treatment, it is important to gather specific details about the patient's history. For healthcare professionals, incorporating this information into their history and physical exam is crucial. As for patients, I recommend making notes of these important factors on a single page so that they can easily discuss them with their doctors during each visit. To provide a comprehensive description of the recent episode, the following details should be included. Onset. It is important to note when the episode started. Was there any warning or aura before the seizure? When was the first episode ever experienced? Duration. How long did the episode last? Was it a brief episode or a prolonged seizure? Symptoms. What specific symptoms were experienced during the episode? Were there any unusual sensations, movements, or behaviors? Consciousness. Did the patient lose consciousness during the episode? If so, for how long? Motor activity. Describe any observed motor activity during the episode. Were there jerking movements, twitching, or abnormal posturing? Autonomic symptoms. Did the patient experience any changes in heart rate, breathing, sweating, or other autonomic functions during the episode? Postictal phase. What happened immediately after the episode? Did the patient experience confusion, drowsiness, weakness, or other post-seizure symptoms? Trigger factors. Were there any specific triggers or factors that seemed to contribute to the episode? For example, sleep deprivation, stress, or exposure to certain stimuli. Environmental factors. Describe the environment in which the episode occurred. Was the patient in a familiar or unfamiliar setting? Were there any potential triggers or factors in the environment? Witness accounts. If there were any witnesses to the episode, their observations and perspective can provide valuable information. Frequency of seizures. How often do seizures occur? Last seizure ever. When was the patient's last seizure? Medication history. Provide a list of medications that have been tried and failed, as well as the current medication being taken, including names and dosages. Side effects. Are there any side effects experienced from the current medication? Medication level. Has the medication level been monitored? It is important to remember that if seizures continue to occur, further adjustment of the medication may be necessary, and triggers should be avoided. If a patient starts exhibiting symptoms similar to being drunk without consuming alcohol, it may indicate that they are taking too much epilepsy medication. My famous saying for toxic side effects of epilepsy medicines are, if you act like a drunk, without being drunk, you may be taking too much medicine. By including these specific details in the comprehensive description, healthcare professionals can better understand the nature of the recent episode, leading to more accurate evaluation and appropriate treatment. For patients, keeping track of these factors and discussing them with their doctors can contribute to a more effective management of their epilepsy. Remember, open and clear communication is key to successful epilepsy management.